Hello, Uta here with my first blooming anemone. I can't remember the variety. It might be one that volunteered actually from, I have pink ones and white ones. The white ones I know are called Honorine Jobert. But so that's an anemone. It's sort of a later bloomer. Yeah. Okay, now this is really a continuation of my series on children and how to talk to children when you are trying to prevent the indoctrination of the so-called trans ideology, what I call cross-sex ideology. I really do recommend that, oh, that you take a look at the playlist, which is called the Hagen Lexicon, because I think it's also important to bring up to children that you like to use very precise words. And so, since gender is not a word that anyone has a secure definition of, then what would be more appropriate to do is call it cross-sex ideology. Now, this is a pretty shocking story about a new lawsuit, uh, which, again, it's a female detransitioner. I We have sort of limited information on how many procedures she had. We do know that she was injecting testosterone, and the shocking thing that happened was there was a male nurse lurking in this center where the kids are meeting, where these mostly teen girls, but I think some boys too, were meeting as a so-called support group. And what we're getting from this lawsuit from Soren Aldaco in Fort Worth, Texas, is that uh, there's definitely recruitment, and there is luring these children in, luring them away from their families, and putting ideas in their head. Now, so it's pretty shocking. It was in reported by Mary Margaret Olohan at the Daily Signal, which is the newsletter of the Heritage Foundation, and you can subscribe to that for free. And I highly recommend doing that because there are wonderful articles by Lior Sapir. And as a matter of fact, there's a new report from him, um, which is about a paper that a doctor wrote saying that what you are doing when you have these children so-called in treatment for so-called gender dysphoria, what they're getting is placebo effect. And I know Exelancic has called it placebo effect too. And it's the attention that they're getting, the indoctrination that you need to take these shots, you need to do this group, you need to talk to people who are only going to be talking about this. And what the detransitioners are telling us is that they start really obsessing about all of this, and they don't develop hobbies. They're not getting out and moving. It's a lot of time online on Tumblr and Reddit, and what we don't know is who is at the other end of the computer talking to your minor child. It is likely an adult who is pretending to be a teenager. So let's just go through this. A male nurse practitioner hung around meetings for transgender children to find clientele for cross-sex hormones, according to a new lawsuit on behalf of a detransitioning young woman. Soren Aldaco's suit alleges that she visited the transgender support group, which is called Transcendence International in Fort Worth, Texas. These aggrandizing names are just remarkable. Uh, and it's a nonprofit dedicated its claims on their website to the support, well-being, and health of our transgender diverse community. But at another point, they say that they are not giving therapy. So Soren, this young woman who is now 21, was connected with Del Scott Perry, Perry, who was widely known throughout the organization as the guy who will prescribe testosterone to youth upon request, according to the lawsuit. This group hosts meetings for transgender children and their supporters, the lawsuit says. So they're calling it TCI for Trans and then Descendants International. TCI would pair transgender children and adolescents with elders to purportedly help guide them through their gender journey. Now, this is typically men like my ex-husband who think that they're women, and they have decided that they are self-appointed experts in this journey, even though they don't have any credentials in child development or actual mainstream psychology or psychiatry. So, and also, this is really putting children at risk, that there's going to possibly be an adult there who is a child sexual molester, because it doesn't sound like they really vet anyone. That's what it's bothering me. I have a hair coming onto my nose. She reported, the young woman reportedly learned that she could get testosterone through, she found out through word of mouth in this group. Since Perry was attending most of the meetings, he's a nurse practitioner. He's a middle-aged guy, and he's attending most of the meetings. And though he himself was not transgender, but you see, he's recruiting clients. He easily connected with her. Perry gave her instructions on how to inject herself with the drugs and sent her on her way. So that happened fast. Notably, to this day, it is still clinically uncertain what the long-term consequences are for the use of these cross-sex hormones in minors, but certain grotesque risks are well known within the medical literature, including for women infertility, vaginal atrophy. I mean, that must be very painful because your vagina is filled with nerve endings. Bone density and growth complications, and many other disfiguring side effects, such as weak teeth syndrome and necrotizing skin in the, or necrotizing tissue in the uterus. And there's, details about cancer, heart ailments, stroke, all these side effects. So Perry failed to discuss not only the risks that she was incurring by taking these drugs, but also the irreversible consequences that would ensue, such as the hair doesn't stop growing on your face if you've been taking it long enough, if you decide that you are going to identify with your sexed body and give up taking the tea. He didn't discuss any alternatives. Instead, he acquiesced to her desire to take testosterone like the other kids. So this is social contagion. Even worse, he didn't discuss or address any of her mental health issues or existing comorbidities or conduct any psychobehavioral mental health analyses before providing her with the first injection of life-altering cross-sex hormones, and she was 17. He never sought or got any written parental consent from her parents. Like many other detransitioners, Soren soon discovered that the cross-sex hormones were causing her severe complications. But rather than taking her off the hormones or reducing her dosage, Perry simply referred Soren out to various medical specialists who could treat the specific side effect symptoms. And he just continued to prescribe the same high dose, and I guess it says administer, so maybe he was giving the shots at first. She was so sufficiently gaslit by Perry that she dismissed at least one of the medical specialist's advice to discontinue use of the cross-sex hormones because they were likely the source of her side effects. And then she decided that she's not going to follow this doctor's advice, and she is, treating this nurse practitioner named Del Scott Perry as if he's some kind of special guru because he is making himself constantly available to these teenagers. I really am hoping that other kids who had this same situation there in Fort Worth, Texas, will also make lawsuits. And he was under the supervision of a physicians group. It's just wild. He was the cross-sex hormone provider for most of the children and adolescents who frequented the group. These kids are looking for companionship. They feel different. They're having a time of confusion and depression. Soren had autism and depression and a couple of other things. He had built this list of clientele from this group over a period of months or years. See, keep in mind, this isn't a treatment that you're going to do for 6 months and then say, okay, now I'm through this. It's a treatment. It's a thing you have to, I guess, keep on taking, or that's what they were doing. So this organization hosting the group didn't respond to any requests for comment about why this guy is there. I think this could be happening in a lot of places where people they're probably giving out cards, they're probably leaving pamphlets. This is something that really has to be looked into. I think that it violates some kind of laws regarding doctors recruiting patients. Okay, he's under the supervision of Texas Health Physicians Group. And no one responded to Mary Margaret Olahan's request to speak to someone about this story. Unless otherwise stated, TCI does not provide mental health services, legal services, or health care, the organization's website says. We've gotten to know a lot of professionals, however, and might be able to get you connected with the right resources. So they regard themselves as a clearinghouse. Perry immediately confirmed upon meeting her that, like the other young people in this group, he would and could prescribe the testosterone she wanted if and when she visited at his office. So she did. She went to the office for her first appointment, and that lasted about 30 minutes. Like she doesn't have a letter, she doesn't have a therapist, she's just going to this support group. This is just loose, almost clandestine manipulations and machinations. Yeah. And okay, so she was put on an estrogen blocker called anastrozole and testosterone cypionate as the blocker of your own estrogen in your body and the insertion of testosterone in a female body. Perry gave her instructions how to inject herself with the drugs and sent her on her way. This is all in the complaint, and of course they're saying alleged this and stuff like that. I'm not going to add this. This is the kind of thing where I just don't think you can make this up. I think that, I believe it. Okay. he didn't discuss or address any of her mental health issues or existing comorbidities or conduct any psychobehavioral mental health analyses. Um, now, and she's now 21. She filed her lawsuit just this last Friday, 2 days ago, in the Tarrant County District Court. She says the doctors behaved more like ideologues than medical professionals, and they did not properly take her autism, depression, anxiety, and other comorbidities, coexisting conditions, into account when they evaluated her for going through this so-called gender transition. The repercussions of these interventions have led to Soren's permanent disfigurement and profound psychological scarring. The defendants' breaches of their fiduciary duties are only understood by the fact that each defendant met Soren and facilitated these therapies. At an important time in her life, she's a 17-year-old confused girl. She has feelings of dissociation and she has black and white thinking because that is a characteristic of autism. She had psychological and social disorders, and there must be a lot of other autistic girls in this group. So, they're they're doing a sort of group therapy, not to treat their autism, not to discuss why do they have this black and white thinking, why did they get into this idea that their body is wrong and they feel wrong, Okay. Despite these telltale signs demanding caution and therapeutic resolution, the physicians deliberately and recklessly propelled her down a path of permanent physical disfigurement and worsening psychological distress. She's one of a growing number of detransitioners, especially females, who have been filing lawsuits against the medical establishment for facilitating their attempted gender transitions. Detransitioner is someone who sought to change things in their body through hormonal or surgical interventions and ultimately regrets this attempt and returns to living as his or her biological sex. Now, what really should be happening is these doctors should be saying, these surgeries, these hormones are dangerous. There are all these ramifications for your body, and it doesn't increase the length of your life. It's going to cause you to be in a very specific group and cause you to be socially isolated with other people who are doing the same thing. And this is just not desirable. And so would you be in a study where we talk about all of your other issues and try to resolve them and consider, these treatments later? And the other thing is the kids really need strategies for dealing with anxiety, such as chiropractic acupressure, Feldenkrais physical therapy, Uta Hagen's wellness movement on my wellness movements playlist, and time out in nature, and also a focus on helping someone else somewhere in the world, taking on a charitable project and taking responsibility, learning some good people skills. This is just really, really out of control if we have random nurse practitioners dropping in on those groups and recruiting the kids for the hormone shots. So I'm going to go see if I can find any more of my little anemones. Be well always.